Well, thank you very much, Michelle and the viewers. This is good news for us because we have had a halt, which was a temporary issue. And of course, we've come out now with a date that we're going to resume on the Wednesday. What is new is that we will be sending in additional information about possible other side effects that people must be alerted to. And in this case, we will then make sure that all those who come in for the remainder of the vaccination redo their consent, and they've got now new information that suggests that there is this risk, although it's very, very low at one person per 1 in a million kind of incidence. Now, it's important for us because we've got, any time now, we'll be receiving 1.1 million vaccines from Johnson Johnson. As we are all aware, they are manufactured, they're waiting for the final audit so that they can be released. So anytime now, we expect them to be with us because they are just here in Gqeberha in Port Elizabeth. So that means now we'll be able to move on. But in the process of moving on, we'll be informing people that there are certain symptoms that they must keep a lookout for. And if they do find those symptoms, they must get checked so that we can just be sure that it's not a problem. And secondly, we will be taking a precaution not to immediately vaccinate pregnant women and those who are lactating mothers until we get additional information. But that means now 1.1 million vaccines, when they come, will be ready to move. Our phase 2 is due to start on the 17th of May. So by that time, we should be able to move. We're also expecting additional vaccines that will come from Pfizer, that will come on the first week of May. And so all of that means that we're ready and set to move from the 17th onwards.
And that's for ordinary South Africans. Minister, I want to just hone in on some of the information that you've just given us now. So in effect, and this is information you've given us before, it's a 1 in a million chance of developing this rare blood clotting. In fact, there's more of a chance of developing COVID-19 related blood clots should you contract the virus. Minister, give us an outline of the symptoms that one does need to look out for once you've received the jab, and indeed, you know, whether it could be related to these serious blood clots.
Well, firstly, I think it's important to say that the risk of developing these blood clots is a very rare situation, and so the risk is not very high. 1 in a million is a very, very low risk, and we know that on the people who have the COVID-19, the risk of getting severe illness and complications and death is much, much higher than this. We also know that even with COVID, you still will find some clotting disorders. I think the figure has been given at around 16% that we'll find in COVID-19. So we're then saying that the risk of getting 1 in a million is a very, very low risk, and therefore it's an important thing to say that for all the drugs and vaccines, there's always going to be a risk, but the risk has to be lower than the risk of that particular side effect must be lower than the risk of getting the real infection. And so from that point of view, we balance it like that and say it's still safe to continue.
Minister, let's talk about pregnant and lactating women. I understand that the Health Products Regulatory Authority has recommended at this stage that they be excluded from the Sisonke protocol at this stage of the rollout plan. In your statement, Minister, I think you also do say that there might be a recommendation from scientists that this decision is re-looked at.
Yes, certainly it's a precaution because there's no conclusive work that has come out to give us exactly what would happen in the case of pregnant women and lactating mothers. And so it's a precaution. So whilst the research work is being done, we will not continue. We hope that the response will come fairly soon to give us guidance in terms of how to deal with those pregnant women and lactating mothers. One of the things that was observed was that of the women, of the people who have been found to these eight people with this clotting disorder, there were actually 8 women aged between 18 and 48. So what are these factors that are associated with that? we don't know. So once we get more analysis, more research, more information, we'll be able to freely move on to deal with the vaccines.
I mean, Minister, as you say that, we don't know yet the impact on pregnant women and on lactating mothers. And I suppose, by the same token, we don't know the impact of the vaccine on an unborn fetus either.
Well, yeah, because we don't have enough information on that, it makes it, a very good precaution to say, let's leave them out for now. But once we get more information, we'll be able to deal with it. So what happens to the fetus, what happens to the mother, and all of that. Most of the time when we're talking about the pregnant mother and lactating mother, it's really more about what happens if it passes from mother to the baby. Right. That's usually the issue that we're looking at. So because these vaccines are new, let's get more research so that we are able to be guided by the scientific findings.
And we don't have a timeline at this point, Minister?
We don't have a timeline, but we are hoping that it won't be too long. But nevertheless, this is a global situation, so the information will come from different parts of the world. So,
Minister, let's talk about the COGTA Minister gazetting the regulations for the COVID-19 Vaccine Injury No-Fault Compensation Scheme. It's quite a long name, but in effect what it means is that this is government's way of trying to protect all its citizens, should indeed there be anyone suffering from a severe or adverse event following getting a vaccine.
This is a no-fault compensation fund which we have agreed to set up, and it's a way of ensuring those who have gone through the vaccine, in the event that they suffer adverse effects, and therefore any harm that's associated with it, we will have a system whereby people will report that they've had side effects. There'll be a panel that will assess and make sure that they can find the link between the injury and the vaccination, and also document the extent of the injury. We'll have another team that will evaluate the cost of compensation for such an individual, and then of course there will be an appeal process in case the person does not feel comfortable with what has been the findings. But this is a way of protecting our people from adverse effects. I have said that in fact it would be a very good system to utilize in health in general, so that anyone who suffered harm out of treatment through health from the health services, whether it's negligence or just side effects or whatever, there must be a way of protecting them. Then we don't need to depend on huge legal processes that will take a person through. In this case, if you got side effects, you don't need a lawyer. You just go and report in an office, and then you go through, fill in the forms, and then the doctors will assess and take you through, so that you don't have the burden of having to go and pay for an expensive legal representation before you can actually get compensated on an issue that we know that people must be feeling comfortable and safe that they can actually get attended to if they suffer any harm. It was the national program.
Yeah, absolutely. Minister, as I'm sure you are well aware, there is a lot of frustration with the timelines associated with our vaccine rollout plan. There is really a sense that South Africa is lagging behind compared to the rest of the world, compared to even countries on the continent, even though we are leading with infections and deaths on the African continent. In fact, in your statement this morning, you say it has been a difficult start for our country with the vaccine rollout. Despite all the challenges we have faced, though, we have a positive outlook. That's just reading from your statement this morning, Minister. What would you like to tell South Africans about where we are at? And, there have been quite a number of stalls on the road to getting our vaccination rollout plan on the go.
Well, Michelle, I think we must go back and say that way back in January, end of January, we received 1 million vaccines from AstraZeneca. And these vaccines would have been actually used from the beginning, from around 15th of February, when we were targeting the starting time for these vaccines. And in that process, we actually had a problem of the variant that made it difficult for us to use those vaccines. Actually, when we were looking at those vaccines, we were going to have 1.5, and there were going to be another 2 million that would have come. So the approach would have been very different if we hadn't had the variant. And so I think it's always important for our people to understand that actually it's not lack of effort and trying to make sure things happen. It's because certain things happen here which were beyond our control. In this case, the variant, we couldn't anticipate the results that came from the variant. Now, the point at this, of course, then we went all out to go and seek the Johnson Johnson. Again, unprecedented, we were able to get the vaccines to come through, but because of the processes involved, they've actually slowed down in the way that they did. We still have not gone past our date. We had said first 3 months, at the end of the 3 months is May 17th. So we're still within that time, although we would have liked to see more activity, but we're still within that time. Now, the phase 2 was supposed to start on the 17th of May going forward. 17th of May is in another week's time. And by then, the vaccines would have arrived. We would have already got the 1.1 million that I've said is waiting in Gqeberha. It's going to come anytime, as soon as they are done with their auditing processes, and that will be available. And then, of course, the first week each of the Pfizer vaccines will be getting 300,000. For the next month, we'll get about 1.4 or so, 1.3, 1.4 for the month of May. So there will be enough vaccines to start. And then by end of June, would have actually received, close to 10 million vaccines in total. So that's what we're targeting and pushing. So I would say our message would be, let's be patient, let's work together. We will actually get there. And when we start this vaccine process, we just need everyone to cooperate with us and we'll be able to meet our targets.
Yeah. So end of June, Minister, 10 million vaccines. Of course, the consideration then is actually dispensing those vaccines and doing so safely. You're confident that we're able to take on what will be the biggest vaccination drive in our country?
We have to push. We have no choice. We have to push. And we actually have got 3,300 sites which will be opened incrementally as the vaccines are available, because you can imagine what's going to happen. If you say I've got 1 million vaccines here, and I say we've got 300 sites, we've got 9 provinces. Out of 9 provinces, and you divide that up, it becomes almost like 100,000 each. Now, that already dissipates. So it means that there's going to be a wide dispersal of all of these vaccines, and we hope that we'll be able to push the numbers. But if we're talking about 3,300 sites, the maximal push by which we'll be getting close to 250,000 people per day will be probably around September, when the numbers of vaccines would have come quite a bit. So at this point, 300,000 you can dispense of within a week, and the following the same thing. But you can't do more than 300,000 because the Pfizer will be already. That's all that will give us. Yeah. So you have to push them up as the numbers are increasing.
Massive job ahead of us. Minister Zweli Mkhize, thank you very much for your time this morning on the AM report.